Listen to it. It can be an essay question or individual types can be asked as short notes. Definition. Definitions are definitions. An embolus is an intravascular, solid, liquid, or gaseous mass that causes obstruction distant from its site of origin. So very complex, which means it does not obstruct the region where it has begun, but it obstructs narrower blood vessels somewhere. See what is happening. This is a normal one, but then there are emboli which are being, this is a thrombus-like thing, and you find that there are emboli, it gets fragmented, it will cause obstruction somewhere. And the process is called embolism. Embolization is a process and embolism is a thing that is being produced. The classification will be, it can be solid, tumor cells or foreign bodies. Liquid, again fat globules, etc. Gaseous, air embolism. And most important will be thromboembolism. And depending on the nature of it, it can be infected. We call it as sterile or bland. Otherwise, it is called infected or septic. This classification you people must write. Thromboembolism. See what is happening in this case. So these are all the various thrombi, atherosclerosis in the heart and aneurysm of the blood vessels. They all get fragmented and produce a thromboembolus, obstructing the cerebral blood vessels. There can be stroke. Renal blood vessels, there can be infarct. Then the intestinal blood vessels, mesenteric blood vessels, there can be infarct. Infarct in organs like the spleen, or sometimes there can be gangrene of the foot. So these are all the things. Any few you people should remember. It is not difficult. The pathogenesis will be. Now, this is a case of air embolism. Air embolism, see what is happening. This particular person has gone for a deep sea diving. Under deep sea, you find that there is a lot of pressure and all the atmospheric gases, such as nitrogen, oxygen, etc., they get dissolved in the blood under pressure. But what is the name of the disease? Decompression. When it starts coming out rapidly, there is a rapid decrease in the pressure. So all the gases that have been pushed into the blood come out as bubbles. That is called decompression. So remember what is in this box and write. Deep sea diving, increased pressure, dissolution of nitrogen and oxygen, rapid decompression, mainly nitrogen bubbles. They will come and cause obstruction, and the lesion is called chokes and bends. Is it clear? It will lead to obstruction of the musculoskeletal, severe pain will be there, chokes, there can be suffocation, and sometimes there can be coma and death. So this can be asked as a question also. Amniotic fluid embolism, just remember. So this is a fetus within the uterus. Sometimes there is a placenta over here. During delivery, there can be a rupture, and then all the structures inside, such as hair, meconium. Meconium means the fecal material, can all enter the maternal circulation. They can cause obstruction. This is called amniotic fluid embolism. The complications are given over here. Similarly, another type is the fat embolism. This is a long bone, probably femur. It has got fractured. The bone contains fat globules. They enter the circulation and cause obstruction. This is called fat embolism. The consequences of any type of emboli, this you people can remember. Ischemia to the brain and heart, there can be edema and hemorrhage. Decompression can lead to ischemic necrosis, and fracture of the head of femur, tibia, etc. can lead to fat embolism. Please remember this. Thank you.